Dr. Okeefe Simmons. Welcome back to Inside South Florida.
Thank you for having me.
Yes, and we love learning from you because you have so much information on everything weight loss.
There's a lot of information out there, so I'm happy to deliver.
That's great. And today we're going to talk about bariatric surgery. So tell us, what should individuals do if they regain the weight after going through a procedure?
Yeah, so this is unfortunately something that's pretty common. There are a couple of different options available. There's the option to have a repeat surgery for some patients. There's the option to take medications for weight loss. And there are also options to have procedures that don't require surgery. And those procedures include a revision for patients who've had a laparoscopic sleeve and revision for patients who've had a gastric bypass, which are the two main types of bariatric surgery that are done.
Okay, and how does that work exactly?
Yeah, so those endoscopic revision procedures are kind of new, so most people aren't familiar with them. So what's going on with those procedures, I'm going in with a thin tube and a camera into the mouth to access the stomach. Once I'm inside the stomach, for the patients who've had a bariatric surgery that is the gastric bypass, my main objective is to close off the exit of the stomach and make that smaller.
Oh.
The other thing that can happen is that the stomach itself can re-expand and get a little bit more dilated. So I'm also trying to make that stomach size smaller. So there's two main objectives, but ultimately what I would like to do is have the food remain in the stomach a little bit longer so you feel full for longer.
Okay.
And also it empties out of the stomach slower. So the main goal is to make sure that you're eating, but you're eating a little bit less and you feel content with that smaller amount that you're eating.
That's amazing.
Yeah.
Now, what are the benefits for non-surgical procedures for this revision?
Yeah, so the benefits are closely mirrored to the bariatric surgery itself, right? So you're going to have significant weight loss with these procedures, but I think what's more important for us is seeing the health benefits, right? So my patients come in and they want to lose weight, but they also some have high blood pressure or type 2 diabetes or fertility issues, fatty liver, you name it. These things are all associated with weight. And what we're trying to do is improve the markers of diabetes, reduce your blood pressure medications, reduce the markers of fatty liver, et cetera. So I think that's something that's even more profound for us. And we know that there's data, and I can tell you anecdotally, I have patients who've benefited in that aspect as well.
That's amazing. And now, who are the candidates for this revision?
Right. So, of course, patients who've had bariatric surgery before.
Okay.
And ideally, again, we're having patients who really understand this comprehensive concept of weight loss. And it's not just this procedure that's going to fix everything. And I'll tell you that the patients who've had bariatric surgery tend to understand this more. You have to make sure you're accompanying those lifestyle changes with the revision procedure. So we make sure that patients have a good understanding that we're going to help you, but you also have to put the effort in terms of the diet and exercise. And we have a comprehensive health coaching plan that helps patients with that.
Well, that's fantastic. Yes, I'm sure patients don't want to go through multiple revisions.
Exactly, right? So you had your surgery before.
Yes.
Hopefully it's one revision and we can maintain from there.
That's amazing. And now for our viewers that are considering revision because of bariatric surgery, regain, right? Weight, where can they go for more information?
Yeah, so if you've had any issues with regaining weight after bariatric surgery, you can visit our website, www.simmonsweightloss.com. Give us a call. We'll be happy to answer any questions and get you scheduled for a consult, 305-204-8558. We're also on social media, Dr. Weight Loss 305 on Instagram and TikTok.
So catchy. Well, thanks again for joining us on Inside South Florida.
Thank you so much for having me.